Hello, welcome to Medial by Dr.farjana Afrin. Today my video lecture topics thigh part 1. In this video lecture I am going to describe anatomical detail information related with the anterior as well as medial compartment of the thigh, their boundaries, content, nerve supply of each of the individual compartment, group function, individual specific function and clinical anatomy related with the compartment. So let's start. Now on screen you can see there are two figures. Let's denote them first. This is figure A and this is figure B. On figure A it's showing the cut section of the thigh. So this is our first topics of discussion. When in the mid of the thigh we cut transversely, we can see from outside to inside or from superficial to deep structures. So what is the first structures? Of course there should be skin. Then followed by superficial fascia, which has two layers, superficial fatty layer and deep membranous layer. After that the deep fascia, this white color. This deep fascia, it will be moved inwards to form septum and divided the whole thigh into different compartment. So on the screen you can see the deep fascia moving inwards and dividing the thigh into different compartment. And inside the compartment there will be muscles. This reddish color all are the muscles. There might be vessels also we are going to get, that means artery, vein, and individual compartment wise nerve also we are going to get. So dissection time, if we superficial to deep move, we are going to get these are the structure. Anyway, our topics of discussion is thigh compartment wise. So let's start first how the compartment is dividing. When the deep fascia, specifically after the superficial fascia, deep fascia move inward, as I said, moving toward the bones, and we know in the thigh the single bones is here, name of that is called femur, and divided the whole thigh into small compartment. Let's see what are the compartment. I will first erase this all. Now first I will be encircle the deep fascia. This white color is the deep fascia and it is dividing whole the thigh into small compartment by moving insides. How it is happen, let's see. So first we will see there is one compartment division like this way. Again from here also one compartment moving deep fascia insides and dividing. So we can see here there are some of the division. Again from this side also you can see there are one deep fascia moving insides. So total how many compartment we got? We got there is a compartment on the front side, anterior, then on the medial aspect of the thigh, medial, and the posterior or back side on the posterior. So total thigh with the help of the deep fascia move inwards divided into three compartments. Our topics of first discussion is today related with the anterior compartment. So let's start anterior compartment. So when we see anterior compartment, in the anterior compartment dissection time we will be starting first from the skin, as like it has two layer, epidermis then dermis. After the skin we are going to get superficial fascia. Here we have to remember the superficial fascia related information. Superficial fascia, it has two parts. One is outer, another one is inner. The superficial outer layer is the fatty layer and inner layer is the membranous layer, or deep layer is the membranous layer. We have to remember the superficial fatty layer and the deep membranous layer, which is continuous above also with the anterior-abdominal wall. Now let's see on the figure B. So here you can see external oblique muscles, that means it is the anterior-abdominal wall muscle, anterior abdominal wall muscles. And in front of that, these are the two layers. First, this is the deep layer, that means the membranous layer, and this white color, this is the fat containing layer. So outer fatty layer, inner, this green color is the membranous layer. Now the membranous layer of the superficial fascia is attached to the linear fashion with the deep fascia of the thigh also. So when it is moving down, it will be moved down and continue with the deep fascia of the thigh, and deep fascia of the thigh is fascia lata. Now this fusion, the line of fusion of the membranous layer of the superficial fascia to the fascia lata in front of the thigh correspond in a flexion crease which is extending from the pubic tubercle. You see this is the pubic tubercle. If we draw a line, just transversely move laterally This is the line of fusion. So what is the name of this line? Name of this line is called Holden's line. Here the membranous layer of the superficial fascia will be continue with the deep fascia of the thigh. This is the important information we have to remember, that membranous layer will be continuous below up to this Holden's line. After that it will be fused with the deep fascia of the thigh. And what is the name of the deep fascia? Name of the deep fascia will be fascia lata. So this is the information related with the superficial fascia we have to remember. In the superficial fascia, there are some content. That's an important point for us. Superficial fascia contain nerve, I'm writing in shortcut, artery, vein, lymph, and bursa. So N for nerve, A for artery, V for vein, L for lymphatics, and B for bursa. So let's see what are the content I here said, individual information. Now on screen you can see multiple figure. Let's denote them one by one. Figure A, it's showing vessels. That means here will be artery plus vein, superficial fascia content. Then on figure B showing cutaneous nerve, superficial fascia containing nerve. And on figure C showing lymph node, superficial fascia containing lymph node. So let's one by one describe. On figure A, the vessels are superficial external pudendal vessels, that means artery plus vein. Keep in mind this superficial external pudendal artery is coming from femoral artery. It is a branch of femoral artery, superficial branch. Then superficial epigastric artery and vein. Superficial epigastric artery is again coming from the femoral artery. Then superficial circumflex iliac vessels, here also artery, which is also coming from the femoral artery. So what are the content of the superficial fascia here? Superficial fascia. The superficial fascia contain artery plus vein. What are the artery? Number 1, superficial external pudendal. Then number 2, superficial epigastric. And number 3, superficial circumflex iliac. Then one vein is large superficial vein, also we can get in the superficial fascia. Name of this is called great Stephanus vein. This great Stephanus vein, I am changing the color. It started to come from lower limb and drain ultimately into this large vein. Name of that is called femoral vein. So this great Stephanus vein also a content of superficial fascia. Number 4. After the superficial fascia containing vessels, now we come for figure B showing the nerve. They are cutaneous nerve. The skin of the front of the thigh is supplied by these 7 cutaneous nerve, and mainly they are deriving from the lumbar plexus. So let's see what are that. Number 1, ilioinguinal nerve. We know already its root value is L1. Number 2, femoral branch of genitofemoral nerve. Its root value is L1 and L2. Then lateral cutaneous nerve of thigh. Then intermediate cutaneous nerve of thigh. These are all below the sartorius supplying, and medial cutaneous nerve of thigh, and all of them root value is L2 and L3. After that you can get two more also. One is Stephanus nerve. Its root value is L3 and L4, and a branch from the obturator nerve, cutaneous branch, actually cutaneous branch of the obturator nerve. Its root value also L2 and L3. These are the cutaneous nerves which are supplying to the front of the thigh area and content of superficial region. After that come for the lymph nodes. If you see the lymph nodes are superficial and actually deep group, but we are discussing about the superficial fascia. The superficial fascia containing lymph nodes are shaped like T, and it has two parts. One is upper horizontal group. You can see here, this is the upper horizontal group which has two parts, lateral and medial part, upper horizontal set of nodes, and lower vertical nodes which is surrounded by this long Stephanus or great Stephanus vein on the lateral side as well as on the medial side. So these are lower vertical sets of node. So as I said, it has T shape. So upper limb is for horizontal set and lower this vertical is for the lower vertical set of nodes. Then we also get on figure D, you can see there are some bursa. So this bursa also superficially placed. It is not exactly on the thigh, it is surrounding on the knee joint area. we will be first denoting the bones, name of that is called patella. Now surrounding the patella in the over the knee joint area there are some bursa which is also considered on the superficial area mainly. In front of the patella there is a bursa, we are saying it is called prepatellar bursa. Above the patella suprapatellar bursa and below the patella infrapatellar bursa. But infrapatellar bursa are two, one is subcutaneous just under the skin, another one is deep. They both are infrapatellar bursa. Now, if we see summarizing the bursa surrounding the knee joint area, one is suprapatellar bursa, number 2 is prepatellar bursa, and number 3 is infrapatellar bursa. Infrapatellar bursa are two, one is subcutaneous or superficial, another one is deep, infrapatellar bursa. Now, related with the bursa, we have to know something more also. If the bursa repeatedly due to friction get inflamed, prepatellar bursa or the subcutaneous infrapatellar bursa, then this condition we are saying it is called bursitis. So, related with the bursa, we have to know inflammation related one condition that is called bursitis. Let us learn about that. Now, on figure you can see, let us denote them figure A and this is figure B. On figure A, you can see a woman cleaning the floor by bending the knee. So, here if constantly the person is doing such type of work, there is a possibility of irritation of the bursa, and there is a possibility of a condition we are saying it is called prepatellar bursitis. So, here the mainly affected bursa will be prepatellar bursa. So, prepatellar bursitis will be developed as mainly the people are sitting such a way by bending the knee and working. So, we can say this prepatellar bursitis, another name is housemaid knee, housemaid's knee. Even the worker who are working on the minor area, they are also bending the knee and working. So, we can also say its another name is called miner's knee. So, which bursa is mainly here affected? You have to remember prepatellar bursa, and the condition is called prepatellar bursitis or housemaid knee or miner's knee. Now, on figure also you can see there is prepatellar bursitis. So, on figure B you see the figure number B here showing this is the inflammation of the and swelling of the bursa in front of the patella, and this is prepatellar bursitis. There is one more bursitis also that is related with the subcutaneous infrapatellar bursa. Now, here you see again there is a figure, let us denote them figure C. Two people differently sitting and working. Already I know this is because of the prepatellar bursa inflammation. So, prepatellar bursitis, here mainly the prepatellar bursa get inflamed, and a very specific prayer conditions, here also there is a possibility of bursa irritation, and that should be the subcutaneous infrapatellar bursa. Subcutaneous infrapatellar bursa. Infrapatellar bursa, and the person who is praying such a way we are saying they are called clergymen. So, if there is subcutaneous infrapatellar bursa irritation because of specifically sitting and praying such a way, this condition we can say it is called clergyman's knee. So, clergyman's knee mainly affected subcutaneous infrapatellar bursitis. So, bursa related these are the information we have to remember. So, as I said, superficial fascia containing structures. The superficial fascia contain nerve I already described, then artery, then vein, then lymph, and lastly the bursa. After the superficial fascia, we are going to get dissection time deep fascia. So, now our next topic is deep fascia. Keep in mind in deep fascia there are some modification. In the deep fascia we will get some modification. So, if your examiner asks you, say, what are the modification of the deep fascia of the thigh? So, you have to learn one by one. I already said the deep fascia encircling the thigh and entering inside and dividing the whole thigh into small compartment. And this deep fascia which is moving inside and dividing the thigh into small compartment, this structure we are saying it is called intramuscular septum. I am writing in shortcut. So, of course, it is a modification of deep fascia. So, number one modification of deep fascia we can here write, that is called intermuscular septum. Then we will get, there is also one more modification of the deep fascia, that is called iliotibial tract. And also we are going to get, there is an opening in the deep fascia, that means the fascia lata, that is called Stephanus opening. Stephanus opening. So, that is all about the modification of deep fascia. Now, intramuscular septum I said already. Let us learn about the last two, that means iliotibial tract and Stephanus opening. Now, on screen you can see there is a figure. Let us denote it figure A. This is the anterior view and this is the lateral view of the deep fascia. Now, deep fascia, I am writing here in shortcut, the deep fascia, always remember the deep fascia of the thigh present modification. I already said about the modification, intramuscular septum, iliotibial tract and Stephanus opening. First, next question will come, then what is iliotibial tract? Keep in mind the deep fascia, another name is fascia lata. The fascia lata, it will be act as a we can say sock type of hold or pajama type of hold the thigh is encircling by the deep fascia. That is fascia lata, nothing but you can see here this fascia lata, hold the thigh is encircling. And when it is encircling, how this fascia lata is arranged? If they ask you, you have to remember superiorly it is front of the thigh attached from the anterior spine. You know this is anterior superior iliac spine. It is attached from the anterior superior spine, then hold this area. What is the name of this? Already we know this is inguinal ligament. So, it is attached also into the inguinal ligament. And even when it is coming on the medial aspect, it will be attached to the pubic tubercle also. Laterally, it is attached above with the iliac crest. It will be attached above with the iliac crest also. And when it is go backside, it will be even attached with the sacrum. You know, this is the sacrum also. And even coccyx, sacrum, coccyx, sacrotuberous ligaments also. And medially, when again it is coming medially, it will be attached with the pubic bones also. It will be attached with the pubic bone also. So, this is the superior attachment. And when it is coming inferiorly, coming down by covering the whole thigh, coming down, it will be come toward the both side of the knee and attach subcutaneously in the bony prominence area and blend with the capsule of the knee joint. So, here in the knee joint area, it will be blend with the capsule of the knee joint. That is all about the fascia lata attachment. Now, I said iliotibial tract. Now, this fascia lata, when it is encircling the whole thigh such a way, on the lateral aspect it became thickened. On the lateral aspect it became thickened. Now, you see the lateral view. On the lateral view, you can see there is a thickening of the fascia lata or deep fascia. And what is the name of this? Iliotibial tract. So, iliotibial tract, it is nothing but the thickening of the fascia lata on the lateral aspect of the thigh and near about 2-inch wide band it is. Superiorly, of course, it will be attached with the iliac crest area and it will be splitted to cover two muscles. This is very important one point. This iliotibial tract here will be covering two muscles and insertion of two muscles will be. So, MCQ times we can ask you what are the two muscles, or viva time we can ask you what are the two muscles inserted into this iliotibial tract. You have to remember, number 1 gluteus maximus, number 2 tensor fascia lata. So, number 1 gluteus maximus and number 2 tensor fascia lata. These are the two muscles inserted into this iliotibial tract. Next, what questions will be, we are going to ask you that what is the function of this iliotibial tract, why there is thickening. Main function is this, that it will be stabilize the knee both in extension and partial flexion. So, it will be stabilize. Stabilize knee both in extension and partial flexion. That is why it is more useful during the time of walking and running. So, iliotibial related, these are the iliotibial tract related, these are the information we have to remember. As we know, there is one more modification of the deep fascia, that is called Stephanus opening. Now, again on the anterior view, you can see there is a small opening on this deep fascia area, and this opening is called Stephanus opening. It is an oval opening in the fascia lata, and it is located 4 centimeter below and lateral to the pubic tubercle. This is the location of pubic tubercle. So, near about 4 centimeter lateral and below will be the location of the Stephanus opening. So, let us learn about Stephanus opening. And where it is located? It is located into the, it is an oval opening in fascia lata, that means the deep fascia. And where it is located? 4 centimeter below and lateral to pubic tubercle. I am writing in shortcut. Now, this normally this Stephanus opening is closed by the areolar tissue, the cribriform fascia, which is pierced by number of structures also. Now, why there is opening? This Stephanus opening will be allow a superficial vein to, I am changing the color, change to run and move inside to drain into the femoral vein. We already know what is the name of this vein. Name of this vein is called great Stephanus vein, which is a superficial vein. So, Stephanus opening through here, great Stephanus vein will be traveling and entering into the draining into the femoral vein. Now, if they ask you, or any other structure also pierce through the Stephanus opening, so let us learn about that structure. Structure pierce or passing. Structure passing through this Stephanus opening. This is a very important question. Number 1, already I said, great Stephanus vein. Number 2, superficial epigastric and superficial external pudendal vessel. We already know superficial epigastric and superficial external pudendal, they are vessels, that means artery plus vein, they both will be running through here. And lastly, lymph nodes. Which lymph node? Of course, the superficial group of lymph node, they will be drained into the deep lymph node through this Stephanus opening. So, these are the questions related with the Stephanus opening in the modification of the deep fascia we have to know. Now, we are going to discuss more inner structures like muscle, vessels and nerve. So, as our topics of discussion is anterior compartment first. So, in the anterior compartment we are going to get muscles. Number 1, muscles are quadriceps femoris. Keep in mind, as it is quadriceps, there should be 4 muscles. What are the 4 muscles? Number 1, rectus femoris, then vastus group, vastus lateralis, I am writing in shortcut, vastus medialis, then vastus intermediates. These are the 4 muscles. Then there will be one more muscles, we are saying it is called articularis genu, then Sartorius, and lastly tensor fasciae lata. These are the muscles of the anterior compartment of the thigh. These muscles are supplied by nerve and artery also. So, what is the nerve for this compartment? Femoral nerve. Though there is one exception also, which is supplied by superior gluteal nerve. Shortly after some time I am going to explain that also. So, 2 nerve you can write here, though main nerve supplies by the femoral nerve. Number 3, as I said, artery supply. So, what will be the arterial supply? Arterial supply by the femoral artery. And as name of this compartment is extensor compartment, name of this muscle containing compartment is called extensor compartment. So we can understand maximum function, the group function, maximum function will be there to do the extension of knee, though there are some more function also for some of the individual muscles. So let's start to describe now one by one these all the muscles. First, on screen you can see there is a muscles. Let's denote on figure A. The muscle name is Sartorius muscle. So my first muscle discussion will be related with Sartorius. Now these Sartorius muscles, we have to know it is the longest muscles in our body. Longest muscles in our body. And it has some synonym. According to its function, its another name is called Taylor muscle. Taylor's muscles. Even we can say its another name is called honeymoon muscle also. Now why we are saying such type of name of Sartorius, I am going to explain you shortly. So let's first start its origin insertion. So if we see the Sartorius muscles, it is obliquely placed one muscles in our body, and it is starting from the anterior superior iliac spine, and obliquely placed from lateral, it's heading toward the medial aspect of the body and crossing the knee joint also, and finishing into the upper surface, upper sections of the tibia on the medial surface. So on the medial surface of the upper part of the shaft of the tibia, it is insertion giving along with two more muscle, that's are gracilis and semitendinosus, and we know the three are making gyre. So origin and insertion we done. Now come for its nerve supply. Sartorius gets nerve supply by anterior division of femoral nerve. As I said, compartment wise, maximum muscle will be supplied by the femoral nerve. So it's supplied by the femoral nerve. Then come for action. Sartorius action is very important. By actions we had given its different name also. So what is their action? What is its action? Its action is to flex hip and knee joint. So you can see it is starting from anterosuperior spine, means it's actually crossing two joint, hip joint also as well as knee joint also. So it will work on both joint. Compartment wise their common function is to extension, but here we can see Sartorius is a unique muscle, it's do flexion of the hip as well as knee. One more function also it has, that is abduction and lateral rotation of hip. This its function. Now as I said, it has some synonym, Taylor muscles or honeymoon muscles. Now I am going to explain why so. The combination of lateral rotation, flexion of the hip and flexion of the knee, it a very specific person you can see on a screen sitting and doing some works. In ancient time, tailor people are sitting such a way and sewing the cloths. That's why we are saying it is called tailor muscles. Even we can say another name of this also, palti positions. And during the time of sexual intercourse, such position is necessary. That's why wheeling sexual intercourse time, these positions the positions are maintained by flexion of the hip and knee and abduction and lateral rotation of the hip joint. That's why we are saying its another name is called honeymoon muscle also. Next, we are going to discuss about the quadriceps group of muscles. On the quadriceps group on screen, you can see, let's denote it figure A and figure B. I am mainly focusing on the figure A. You can see there are three muscles, that is vastus lateralis on the lateral side. Here also you can see this is vastus lateralis. On the medial aspect, this is vastus medialis, and on the center, this is the rectus femoris. So let's first start with the descriptions related with the rectus femoris, followed by other muscles also I am going to say. So, let us start rectus femoris. Now, this rectus femoris, by seeing you have to remember the muscles. This rectus femoris is a bipinnate belly. You can see it has bipinnate belly. So, it has bipinnate belly, superficial one muscles. This is very important one point. Image based questions coming means we have to remember that if there is any bipinnate muscles just on the center and more superficial and both side there is vastus lateralis and medialis, you can confirm it is rectus femoris. So, it is a bipinnate belly muscle. These rectus femoris also have some name. Rectus femoris, another name is called kicking muscle. Of course, same like Sartorius, it has some very specific function, that is why we are saying it is called kicking muscles. Slowly we are going to know about that. First, let us see what is the origin and insertion of the rectus femoris. Rectus femoris, it has two heads. Straight head is coming from the anterior inferior iliac spine, and oblique head it will be coming from above the acetabulum. There is a groove. From here the oblique head will be started to come. On the figure B you can see lateral view showing. So, two head they will be joined and ultimately they will be inserted into the base of the patella. They will be inserted into the base of the patellar region. Now, what is its nerve supply? Its nerve supply will be the posterior division of femoral nerve. Next, what is its action? Action will be explaining the kicking muscles explanation. It will do extension the knee and flexion of the hip as it is crossing two joint, hip joint also as well as knee joint also. So, it will do extension of knee and flexion of hip joint, and very specific features is responsible for kicking during the time of football player. That is why we are saying it is a kicking muscles. Now, remaining muscles, let us describe remaining muscles of the quadriceps. First come for the vastus lateralis. I am writing here in shortcut vastus lateralis. The vastus lateralis, it takes from the linear origin from the intertrochanteric line lateral aspect. We know from greater to lesser trochanter anteriorly there is intertrochanteric line. From the lateral aspect of the intertrochanteric line, upper lateral aspect of the intertrochanteric line, from here it will be get originate, and insertion giving again into the patellar region, base of the patellar region. So, in the base of the patellar region it will be get inserted. Even extension also will be formed as a retinaculum, on the tibial aspect it will be make patellar retinaculum, lateral patellar retinaculum also will be formed. That is all about the vastus lateralis origin and insertion. What is its nerve supply? Its nerve supply by same posterior division of femoral nerve. I am writing in shortcut. What does it do as an action? Action will be same. It will be doing extension of knee joint as they are extensor compartment muscle, extension of knee joint. That is all about the vastus lateralis. Come for the vastus medialis. Again, I am writing here in shortcut vastus medialis. The vastus medialis, it will be take origin from the anterior intertrochanteric lines on the medial aspect. From here it will be take origin, and insertion giving again into the base of the patella toward the medial aspect, and extension will be formed medial patellar retinaculum. Now, here a point we have to remember, the vastus lateralis is coming also into the patella, vastus medialis also will be coming to the patella. The more massive insertion will be toward the medial aspect compared with the lateral aspect. Again, I want to say that this vastus medialis, maximum medial surface of the patella it will be covered and medial patellar retinaculum will be formed. But if we see, I am changing the color, vastus lateralis, it will be very less area covering. Because of that, as vastus medialis will be secure maximum the medial aspect of the patella, if patella get displaced, commonly displaced will be toward the lateral side. And why does it happen? Because vastus lateralis less area of attachment toward the lateral side. So, vastus medialis origin insertion, after then come for nerve supply, same. The nerve supply by the vastus for the vastus medialis will be from again posterior division of the femoral nerve, posterior division of femoral nerve. What does its action? Same action, it will do also extension of knee joint. So, we got about the 4 quadriceps muscles. Number 1 rectus femoris, number 2 vastus lateralis, number 3 vastus medialis. Now as it is 4, one more is left, that is the vastus intermediates. Let's see. On screen you can see again, let's denote it as a figure A. Here you can see the vastus intermediates. When we remove this rectus femoris, you can see the rectus femoris was the most superficial muscle, and if you can remember, it was a bipinnate muscle. When we remove, then at the same level inside we are going to get this vastus intermediates, which is the 4th number muscle out of quadriceps. So let's learn about the vastus intermediates related information. It takes origin from the anterior surface of the upper 3/4 of the shaft of the femur. So from the femur, upper 3/4 of the anterior surface, from here it will be get origin, and insertion into the base of the patella. Insertion into the base of the patella. Deep to the rectus femoris. First rectus femoris, and deep to that there will be insertion of the vastus intermediates. What is its nerve supply? Its nerve supply will be also same, the posterior division of femoral nerve. What does its action? Its action is also extension of knee joint. So as I said, group function is extension. So all the quadriceps are doing extension of knee joint. It's a common function for the quadriceps group of muscles. Now come for next two muscle. One is articularis genu, another one is tensor fascia lata. Let's denote them on two figure A and figure B. First I am going to say about a very small and most deeper muscles of the anterior compartment of the thigh. Name of that is called articularis genu. Keep in mind, it is the most deep muscles, and it has 3 or 4 muscle slips, and it is considered as a detached tendon of vastus intermediates also. So it is considered as a detached tendon of vastus intermediates. These 2 points you please remember. Where does from it is get origin? It origin from the femur, lower part of the shaft of the femur. From here it is originating, and insertion, very interestingly, this muscles is inserted into a synovial membrane of knee joint. So quite unique features, it get inserted into the synovial membrane covering the knee joint area. So it will be protect, of course, the knee joint synovial membrane, specifically when the knee is extended. So if anyone asks you what is the nerve supply of articularis genu, same nerve supply, of course, because it is a detached tendon of vastus intermediates. So same nerve supply will be posterior division of femoral nerve will be supplied. And if we ask what is the action, its main function is to protect the synovial membrane, specifically when the person do extension, the extended knee time. That is all about the articularis genu. More specifically, please remember these 2 points. Next come for on the figure B, the last muscles of today's discussion, that is the tensor fascia lata. This is also a very unique muscle. What are the specific unique features for that? Morphologically, it believed that tensor fascia lata is actually a muscles of the gluteal region, but it get migrated to the lateral aspect of the thigh and considered as an anterior compartment of the thigh muscles. And its more unique feature is its nerve supply. Starting time I said anterior compartment mainly supplied by the femoral nerve, but there is an exception. What is the exception? Exception is this tensor fascia lata. It is supplied by the nerve of the gluteal region. Name of that is called superior gluteal nerve. So first I wrote about the nerve supply. And what is its action? Its action is to do abduction of the hip joint and maintain the extended position of the knee joint. So extension of knee joint. So it works on the 2 joint. Now let's come for its origin and insertion. So if you see on figure B, the origin is from the iliac crest. So in the iliac crest, it gets origin from the outer lip and anterosuperior iliac spine also. So it is originating from the anterosuperior iliac spine and tubercle of the iliac crest. And very important one point is its insertion. Normally we see maximum muscles of the anterior compartments are inserting into the bones. Exception is articularis genu, which is inserted into the synovial membrane. Another exception we are going to get in the tensor fascia lata also. It get inserted into a deep fascia which is thickened on the lateral side. Name of that is called iliotibial tract. So these muscles come down and inserted into the iliotibial tract. Keep in mind, iliotibial tract, I already said there are two muscle insertion. Number one is gluteus maximus, another one is tensor fascia lata. So that's all about the muscles of the anterior compartment of the thigh related information. Now our next topics of discussion in this compartment: vessel, artery, mainly I am going to say first, that is the femoral artery. So femoral artery, it is the chief artery of the lower limb. It is the continuation of which artery, and it will be continue as which artery we are usually asking. So it is continuation of external iliac artery. So on screen you can see this is the inguinal ligament. This is the inguinal ligament, and this is the external iliac artery. And this external iliac artery, when it is crossed the inguinal ligament, it will be continue as a femoral artery. So external iliac artery continuation is the femoral artery. And when the femoral artery will be cross hiatus magnus and go to the back sides and continue as a popliteal artery. So when it is continue, femoral artery will be continue from external iliac artery, and then femoral artery will be continue as a popliteal artery into the popliteal fossa when it is entered. Then these femoral artery branches we are asking. In femoral triangle there are two branches. Femoral triangle area, it has two type of branch, superficial and deep. Superficial actually already we discussed. Superficial I am writing in shortcut. Superficial branch are superficial epigastric, superficial circumflex iliac, and superficial external pudendal. These are the superficial branches, and there are three branches. What are that? Number one is profunda femoris artery, it is the largest branch. Then deep external pudendal artery, and lastly the branches for the muscles of the anterior compartment. So we can say muscular branches. These are the branches we are going to get into the femoral triangle. Now when it is coming more down the femoral artery, it will be reached in the middle aspect of the thigh, a canal. We are saying name of this is called adductor canal. Dissections related video, I more details discuss about the adductor canal. Right now you just remember adductor canal area, what are the branches. In the adductor canal it is going to give branches. We are saying for the muscles actually again it is going to give. So we are saying it is called muscular branch and descending genicular artery also. So there are only two branch. One is muscular branch, another one is called, you can see here also, descending genicular branch. These are the two branches we are getting. So on femoral triangle what are the branch, and on the adductor canal what are the branch, examiner can ask you. So femoral artery related there are some of the clinical informations also in femoral triangle elaborately I described. Please check that video to get the information, clinical information related with the femoral artery in this femoral triangle. Now next come for after the femoral artery in this compartment, I am going to say about the femoral vein. So on screen you can see our next topics of discussion, femoral vein. Femoral vein, it is the upward, you can see here this is the femoral vein, it is going through the adductor canal and it is continuation of which vein? Now opposite, reverse we are going. So popliteal vein, it will be continue as a femoral vein. So femoral vein is upward continuation of which vein? Popliteal vein. Popliteal vein. So, examiner can ask you. Next question will come, this femoral vein is getting tributaries. So, what are the tributaries of the femoral vein? Here you can see the saphenous opening is there, and already we know great saphenous vein will be come to join into the femoral vein. So, first tributaries we can write great saphenous vein. Number 2, profunda. Profunda femoris vein. And number 3, medial and lateral circumflex vein. 2 more are there. If it is possible for you, try to remember deep external pudendal vein, and lastly direct muscular vein. The muscular tributaries from the muscles, the vein will be also draining into this femoral vein. So, I am writing here only muscular veins. These are the tributaries we have to remember. Now, here one clinical questions we are asking, if want to do coronary angiogram through this femoral vein, because femoral vein is a very superficial vein in the femoral triangle area. So, we can choose this femoral vein for coronary angiogram. Your examiner can ask you route to the from femoral vein go to the roots of heart. So, what is the route? If you started to approach through this femoral vein, how can you enter into the heart? So, the route you have to remember first. Let us start from femoral vein. Femoral vein will be continue up as a external iliac vein. External iliac vein will be continue to as common iliac vein. Common iliac vein will be continue as an inferior vena cava, and we all know inferior vena cava will be enter into the right atrium. From here you can approach even to the right ventricle also. So, this is the route to enter into the heart through the femoral vein. Exam point of view, during the time of viva we can ask you, or during the time of MCQ also we can give these questions. That is all about the femoral vein related information. Now, in the anterior compartment there is a very specific nerve, name of that is called femoral nerve. So, our last topics of anterior compartment of the thigh related is the femoral nerve. Femoral nerve is the chief nerve of the anterior compartment of the thigh, and it is coming from the dorsal division of the L2, L3 and L4 of the lumbar plexus. So, femoral nerve, it is root value, if anyone asks you, say its root value. So, root value is dorsal division of whom? Dorsal division of L2, L3, L4 of lumbar plexus. Now, when it is crossing this inguinal ligament area, after that near about 2 centimeter below, this femoral nerve will be divided into 2 divisions. You can see here, one is the anterior division, another one is the posterior division. So, femoral nerve here will be 2 division giving anterior and posterior. So, it has 2 division. One is anterior, another one is posterior. The anterior division you can see here, it is giving cutaneous, medial cutaneous nerve and intermediate cutaneous nerve. So, it is giving sensory supply by 2 cutaneous nerve. One is, it has 2 type of supply, sensory and motor. Sensory is again medial and intermediate cutaneous nerve of thigh, and motor is only for one muscle, name of that is called Sartorius. So, Sartorius is the only muscle which is getting supplied by the anterior division of femoral nerve. Now, come for the posterior division. Posterior division, it is also giving cutaneous branches, and name of that is called sensory saphenous nerve. So, again it has 2, one is sensory, that is by the saphenous nerve, and another will be the motor. Motor are all for the quadriceps. If you can remember the 4 muscle, rectus femoris, vastus lateralis, vastus intermediates and vastus medialis. Even articularis genu also getting supplied by a tweak from the vastus intermediate supplying muscles. So, motor supply for the 4 quadriceps, okay, 4 muscles we already know, plus articularis genu. These are the all muscles who are supplied by the posterior division of the femoral nerve. So, that is all about the anterior compartment of the thigh related information. Now, let us start to describe about the medial compartment. Medial compartment of thigh. Medial compartment, another name is adductor compartment, because maximum muscles will be do the adduction of the hip joint. So, let us start. What are the muscles? Muscles of the adductor compartment will be adductor longus, I am writing in shortcut, then adductor brevis, then adductor magnus, then gracilis, then pectineus and obturator externus. These are the muscles, and this compartment nerve supply is mainly, chief nerve is for this compartment is obturator nerve, though there is some exception. Femoral nerve also have here contribution to supply in specific muscles. So, two nerve you can here remember. What is the artery? Artery of this compartment is profunda femoris artery and obturator artery. Profunda femoris artery and obturator artery. That is all about some of the small shortcut information related with the medial compartment. Now, let us see on screen there is a figure, let us denote it figure A. You can see the muscles arrangement from superficial to deep are here shown. On the most first layer we are going to get pectineus, adductor longus and gracilis. These are the superficial. In the intermediate area or the middle area or the second area, we are going to get a muscle that is called adductor brevis, adductor brevis, and the third layer or more posterior deeper layer will be adductor magnus. So, superficial, then middle, then the most inner or posterior layer we are going to get adductor magnus. So, we can say the muscles are arranged in 3 layers, first, second and third, or we can say anterior, middle and posterior. All the muscles of the adductor compartment of the thigh supplied by the obturator nerve, I already said, though there are some exception which has contribution from the femoral nerve also. Slowly we are going to learn about that. Now, let us start one by one the muscles. Now, on screen again you can see a figure, let us denote it figure B. Here maximum muscle is showing. Let us first start with the pectineus. The pectineus muscles is flat quadrilateral muscles, and it is also having a contribution in forming the floor of the femoral triangle. We know femoral triangle floor is formed by iliacus, psoas major, pectineus and adductor longus. Anyway, so pectineus muscles related one information we have to remember, it has contribution in forming the floor of femoral triangle. From where it is origin? It is origin from the pectineus muscles, it origin from the pecten pubis, it origin from the pecten pubis pectineate line of the superior ramus of the pubis. Where does it get inserted? It will be inserted along with the lesser trochanter of the upper end of the linea aspera. So, iliacus and psoas major, they will be inserted into this lesser trochanter area. After that, there will be pectineus muscles in the upper end of the linea aspera. Here will be relation with the insertion of pectineus muscles. What is its nerve supply? Now come for the exception. If you can remember, I said there are some exception. So, exception is pectineus muscles. Pectineus muscles have two nerve supply. So, you can remember it is a hybrid, or we can say composite muscle, composite muscles. As it is a hybrid or composite muscles, now exception will come. Pectineus is supplied by two nerve. What are the two nerve? One will be the femoral nerve and another will be the anterior division of obturator nerve. So, anterior fiber of the pectineus will be supplied by femoral nerve and the posterior fiber of the pectineus will be supplied by the obturator nerve. I am writing in shortcut. What is the action of the pectineus muscles? It adduct the hip joint. So, nerve supply I said, this is the nerve supply. Now come for action. Action is, it will be, as it is adductor compartment, so it will do adduct the hip joint. That is about the pectineus. Now come for adductor longus. Adductor longus, this is adductor longus, you can see, this is adductor longus. Adductor longus also, it has two information related to the femoral triangle. We have to remember it is forming boundary. Which boundary? Medial boundary. Medial boundary of femoral triangle. I am writing in shortcut. And it also helps in forming, or has contribution in forming, the floor of femoral triangle. This adductor longus, it is arises from the body of the pubis and pubic crest and pubis symphysis. Where does it get inserted? So, from pubis area it is get originate. It will be inserted into the medial 1/3 of the linea aspera area. What is its nerve supply? Its nerve supply is by the anterior division of obturator nerve. Anterior division. Anterior division. And what is action? It is the powerful adductor and medial rotator of the thigh at hip joint. Keep in mind, it is the powerful adductor and medial rotator of hip joint. During the horse riding time, this action is very, very necessary. That is why sometimes we are saying this muscle is called horse riding muscle also. And inside this muscle there is a possibility of formation of a sesamoid bones, and name of that bones is called rider's bone. So, who is the horse riding muscle? Adductor longus. And in the adductor longus there is a possibility of calcification of the tendon and formation of a bones. Name of that bones is called rider's bones. Next come for adductor brevis. You can see here adductor brevis. Adductor brevis also a triangular muscles. Just underneath the adductor longus it is located, and this adductor brevis, it arises from the body of the symphysis pubis. From here it is originating, and inferior ramus of the pubis also a point of origin between the gracilis and obturator externus. From this area it is originating. Where it is inserted? It will be inserted into the line extending from lesser trochanter to the upper part of the linea aspera. In the linea aspera area it is insertion giving. What is its nerve supply? It usually supplied by anterior division of obturator nerve. So, what is its nerve supply? Anterior division of obturator nerve. But sometimes it may also getting supplied by the posterior division of obturator nerve. What is its action? Its action is same, compartment wise action. It will do adduction of thigh. Now, one more muscle also in this screen you can see, that is gracilis. Gracilis, it is the long cylindrical muscles which lies on the medial side of the adductor compartment. It is the only one muscle of the adductor compartment which is not attached with the femur. Is a very, very important point you have to remember. The muscle which is not has any relation with the femur is the gracilis. Very easily you can see it is arising from the pubis and it is inserted into the tibia along with the semitendinosus and sartorius, forming a guy rope. So, what is the gracilis nerve supply? It is supplied by anterior division of the obturator nerve, and this gracilis has an action of adduction of the thigh. So, let us write something about the gracilis. Gracilis, what is its nerve supply? Its nerve supply is anterior division of femoral nerve. Now, what is the action of gracilis? The action of gracilis is adduct, same adductor compartment muscle. So, adduct the thigh. So, it will be do adduction of the thigh. In addition, it has some other function also, flexion of knee as well as medial rotation of leg. The all adductor group of muscles has a very common function of adduction of thigh. That's why we can say collectively them custodians of virginity. So these all muscles collectively we are saying custodian of virginity. Among gracilis, more specifically we are saying it is called custodian of virginity muscles. Next, one muscle here that is called adductor magnus. Individually, separately, I explained about these muscles. By seeing here image, you can see name of this muscle is called adductor magnus. Now, adductor magnus, it has 2 points of origin. One is called hamstring part, which is from the posterior aspect of the ischial tuberosity originating. Another one is the adductor part, which is coming from the conjoint ischiopubic ramus area. So, adductor magnus have 2 points of origin. And insertion it is giving into the medial margin of the gluteal tuberosity on the back sides of the femur and on posterior surface of the upper part of the femur. In the linea aspera also it is inserting, and it is also inserting into the adductor tubercle of the femur. Now, adductor magnus related, as I said, there are some exceptions. Starting time I already said. So, again we are going to get the nerve supply. Adductor magnus is a hybrid muscles, or we can say composite muscles. So, these muscles have two supply. One, the adductor part, it will be, when means this part, the adductor part, it will be supplied by the posterior division of the nerves, and the hamstring part will be part by the tibial part of the sciatic nerve. So, adductor part will be supplied by the posterior division of obturator nerve, and the hamstring or posterior, this part hamstring part, it is supplied by the sciatic nerve one part, that is the tibial part of sciatic nerve. And what is its action? Its action is adduction of the thigh, adduction of thigh, as well as medial rotation of thigh. These are the main two functions of the adductor magnus. After that, obturator externus. Obturator externus, it arises from the outer surface of the anterior half of the obturator membrane. Right now, it is not showing. From this obturator membrane area, it will be arising, and insertion will be giving obturator externus into the posterior surface of the neck of the femur area in the trochanteric fossa. So, from here on the back side it will go, and on the trochanteric fossa it will be inserted. So, what is the nerve supply of the obturator externus? It is supplied by the posterior division of the obturator nerve. And keep in mind, this obturator externus, it has a very unique function. Its action is unique. It do lateral rotation. It do lateral rotation of thigh. So, related with the obturator externus, we have to remember it has a unique function. Maximum muscles we see they are doing medial rotation, but this is the only one muscles which is doing lateral rotation of the thigh. So, that is all about the medial compartment of the thigh muscles related information. Now, come for the nerve supply of the medial compartment of the thigh. Femoral nerve I already described. So, here I am going to say only about the obturator nerve. Obturator nerve is the chief nerve of the adductor or medial compartment of the thigh. So, where from it is arising? It is arising from the ventral division. If anyone asks you, say the root value. So, it is arising from the ventral division of L2, L3, L4 of lumbar plexus. Now, when we see the obturator nerve through the obturator foramen, when it is passing, it is giving multiple area to supply. The anterior division, it will be supplied to the pectineus muscles, a tweak to pectineus muscles, adductor brevis, then adductor longus. It is giving a articular supply to the hip joint area. Gracilis also will be supplied, and medial aspect of the thigh skin also will be supplied. So, anterior division, it is passing downs and supplied to the muscles. Muscular branch will be supplied to the longus, brevis, pectineus and gracilis. Articular branch will be supplied to the hip joint area, and this is the sensory supply. So, these are the motor, sensory and articular branches to supply. If we see the posterior division also have supply to the following muscles: obturator externus, then adductor portion of the adductor magnus. Again, it is also having a articular branch to supply to the knee joint. So, these are articular branch, these are the motor branch to supply. So, if we do summarize, we can understand the obturator nerve have two division. It has two division. What are the two division? Anterior and posterior. Anterior have three type of branch. What are that? Number one, articular. I already said it is supplying to hip joint area. Then it has motor supply to the adductor longus, brevis, pectineus and gracilis, and it also have sensory supply to the medial thigh area. And the posterior division, when we see, again it has articular branch, and this articular branch will be supplied to knee joint area, and motor supply to the adductor magnus half and obturator externus muscles. So, here we have to remember that the both divisions had articular supplying branches, which is important, and sometimes we are asking. In this compartment, one artery is supplying, name of that is called profunda femoris artery. Sometimes we are asking profunda femoris artery is coming from where? You have to remember profunda femoris artery, I am writing here only. The artery we said already, profunda femoris artery. Profunda femoris artery is the largest branch of the femoral artery, and it is the chief source of supply of these three compartment of the thigh muscles. So, next question will come, then say what are the branches of the profunda femoris artery. Keep in mind it has supply to the muscle, so there will be muscular branches. Then circumflex branch, medial circumflex femoral artery, I am writing in shortcut. Then lateral circumflex femoral artery, and four perforating branches which is travelling through the adductor magnus to go to the posterior aspect of the thigh area to giving supply. Next, obturator artery. So, next question will come obturator artery related. As we said, in this compartment there are two arteries. Obturator artery is arising from the anterior division of internal iliac artery. So, from where it is arises? It is arises from anterior division of internal iliac artery and enter into the pelvis and it will be supply. On here also on screen you can see this is the internal iliac artery. Common iliac artery is divided into two, external and internal iliac artery. From internal iliac artery, one division, this is the anterior division of the internal iliac artery, which is obturator artery, supplied to this medial compartment of the thigh area muscles also. So, this artery is arising from the internal iliac artery. So, that is all about the medial compartment of the thigh related information. In this video lecture, I gave information related with the anterior as well as medial compartment of the thigh. Thank you for listening.